the Manyata definitely has brought a lot of change in the clinical practice in our country, and we need to convey this message to the remaining people who have not yet joined. Because what I realized over years that every clinician, every owner of a private facility wants to have improvements in their clinical practice, and it is not only related to the patient care, but a lot of things which are involved with the staff as well as the protocols, availability of the drugs, availability of the equipments, and all that gets streamlined. Suppose we join the Manyata, and that's why the entire team is really working wonderfully good. So I must congratulate the entire group for that. In fact, when I was vice president of Roxy, that time we started this discussion, and eventually I got involved more with the ISOPA when I was little away from the Manyata, but I was getting all the updates from the Hema and Rishi and all those people, and they were telling it's wonderfully doing well, and that's why we need to take it further as well. Yes. Now coming to the next standard. Can I have the next slide, please? Yes. The antenatal care is the crux of the obstetric care. Though many times in between we were thinking that only emergency obstetric care need to be emphasized. But I feel personally both are complementary to each other. We need to have a good antenatal care as well with a good obstetric care which is required at the time of emergency or routine obstetric cases as well. Because we can assess women by history taking, by clinical examination, and by the investigations which we do, and we can identify the high risk pregnancies. It is very true that sometimes low risk pregnancy also gets some complications. We should be prepared for all actually the childbirth or the all pregnancies which are coming to us in our facility. But the high risk pregnancy definitely need little more attention, and probably protocols are little different than what we do as a routine antenatal care or routine intranatal care as well. Next, please. So, what is antenatal care? Antenatal care is a systematic care of women during pregnancy to monitor the progress of fetal growth and to ascertain the well-being of the mother and the fetus. You know, this particular thing which we had started as a module, that was long back before even Manyata, that is in 1990, we used to call it the RCH module, and we tried it for one of the district in Sholapur in four corners, four taluka places, and we realized that this antenatal care which is offered by the clinicians who are at the grassroots level, they can definitely bring down the complications. Suppose we tell them about the antenatal care as well, and that's why yesterday when I was speaking with Anupama, I told her that yes, we need to tell each and everyone who are actually dealing with the antenatal care about the certain facts, and at the same time the compliance of the patient also need to be done with a good counseling, what is again a part of this particular training program. Next, the interventions that can prevent maternal death are the identification, treatment of the anemia, nutritional counseling accordingly need to be done, screening the infection, telling about the calcium supplementation, proper BP monitoring and the hypertension management, family planning counseling, good opportunity at this moment when they are more receptive, identification of the high risk pregnancy, and accordingly the proper interventions. Next. Yeah, next slide, please. Yeah. Yes. So there is definitely good tools available nowadays for screening or the treatment of the maternal infection. I remember in earlier days we used to think about only the tetanus toxide, and we used to accordingly do the correction whenever required, or we used to do the prophylaxis. But nowadays we have realized that a lot of actually things can be screened. In earlier days, even screening for the thyroid was not very routine, but now actually there is a lot of change in the screening as well as the all prophylaxis which is required. Next. Yeah, next please. Yes, the timing of ANC visits are very important. Though we say it's the first visit, second visit, and third and fourth visit for the mass scale, These four visits are very, very important. And the WHO ANC model now recommends a minimum of 8 contacts. Many of the centers nowadays, yeah, I think someone is written about Hindi and Marathi. Okay, so what we'll do, we'll make a mix of it, and accordingly we'll do the needful so that those who are attending definitely will be able to understand what I'm saying about. So हम बोलते हैं कि 4 visits very important है, but otherwise many facilities. No Marathi, please. Okay, good. So, like in quite often we advise them that once in a month for first 7 months, in seventh and eighth month every 15 days, and in the ninth month every 7 days. But when it comes to mass application, quite often it is not practical. कई बार ये संभव नहीं होता, तो फोर विजिट्स आर वेरी वेरी इंपॉर्टेंट. ये 4 विजिट्स का इम्पोर्टेंस हमें पेशेंट्स को बताना बहुत जरूरी है. नेक्स्ट प्लीज. नेक्स्ट. या व्हाट आर द कंपोनेंट्स ऑफ एनसी. इस विजिट के दरमियान हमको क्या क्या करना है. द जनरल असेसमेंट इन द स्क्रीनिंग टेस्ट, proper history, proper examination, abdominal examination, and certain routine investigations which are now adopted in our antenatal care, like उसका hemoglobin कितना है, उसकी OGTT क्या बताती है, उसके जो इन्फेक्शंस के लिए स्क्रीनिंग हम करते हैं, जिसमें HIV, ऑस्टियो एंटीजन, सिफिलिस, कई सारे सेंटर्स में उन्हें हेपेटाइटिस सी, doing urine examination, urine for the protein, sugar, and blood group, and the ultrasound. What prophylaxis we need to offer? क्या देना चाहिए? तो folic acid, the iron supplementation, injection tetanus, calcium, and the albendazole actually whenever required, and the malaria prophylaxis whenever required. Now, the counseling is the very, very important, where we need to tell them about the birth preparedness, because quite often our women are working women. वो कई बार काम करती है, ऑफिस में हो या खेतों में हो या फैक्ट्रीज में हो, उनके लिए सारे प्रोविजंस उनको बताना जरूरी है. उनको रेस्ट कितनी लेनी है, डाइट क्या लेना है, उनको ब्रेस्ट फीडिंग के बारे में बहुत इंपॉर्टेंट है टू टेल अबाउट द taking care of the nipple, because quite often we see that they deliver, and when we see the nipples are totally retracted and they are unable to do the breastfeeding, उनको breastfeeding करना संभव नहीं हो पाता. So from 7 months itself we ask them to take care of their nipple so that they should be ready for the feeding immediately after birth. About the sexual activity, again there are a lot of confusion about this particular fact, and we'll have to tell according to the scene of that particular pregnancy. About the domestic violence, yes, it's very important. During this pregnancy period they may be having certain issues, and we'll have to take the care of that as well. Quite often we used to think that it is not our actually the domain to take care of this domestic violence, but we have included that in our curriculum also, and we have decided to support them for that particular thing. The healthy timing and spacing of the pregnancy and contraceptive method is very important, because many of the times this contraception is the important thing which we can give them at this very receptive period when they are ready to understand that. And the treatment of the all physiological symptoms or the all those identified complication is again an important intervention. कई बार ऐसा होता है कि ब्लड प्रेशर ज्यादा होने के बाद दे गो समवेयर एल्स एंड दे से दैट माय बीपी इज नॉर्मल, but we need to tell them what are the complications they will face suppose they neglect this high blood pressure. And similar is the case when there is a high blood sugar level. कई बार हमने प्रैक्टिस में ये देखा है कि ये काउंसलिंग बहुत मायने रखता है, जहाँ पे हमको जो भी आइडेंटिफाई होता है उनके केस के बारे में, उनको एडिक्वेटली उसके बारे में बताना बहुत जरूरी होता है. और वो बताने के लिए केवल डॉक्टर ही नहीं, इवन द नर्सेस कैन प्ले मेजर रोल, इवन द काउंसलर्स also can play major roles as well. We have decided this particular practice in my own facility and probably may be useful to you all as well. There are quite few youngsters nowadays who do the courses in counseling, and probably you can appoint them. They may be helpful to you not only for this particular condition in the antenatal period, but all other services which you are providing in your nursing homes. Next, please. And whatever you are going to identify, you have to document it. That is very, very, very important. Quite often, the high risk pregnancies are the set of clinical conditions which if left untreated can lead to poor outcome of the pregnancy, or rather can even cause the maternal or the neonatal mortality or the morbidity. Nearly 15% of the all pregnancies develop some or other type of complications during pregnancy, during childbirth, or even during postpartum period as well. So, identification of these pregnancies and referral to the higher center for diagnosis, management, and treatment is very, very important. स्पेशली दोज हु आर प्रैक्टिसिंग. मुझे मालूम है कि कई जगह से लोग यहाँ पे ज्वाइन उन्होंने किया है, स्पेशली एट द तालुका प्लेसेस और व्हाट वी कॉल तहसील लेवल पे. शायद उनके पास प्री एक्लाम्पशिया के लिए या प्रेगनेंसी विथ वेरी हाई ब्लड शुगर लेवल के लिए सुविधा उपलब्ध ना हो, तो उनको ये रेफरल बहुत इंपॉर्टेंट होता है. कई बार ये देखा गया है कि while doing this referral the proper sheet is not given, proper note is not given. तो अच्छे से जो जो आपने किया है, जो जो आपने आइडेंटिफाई किया है, उसको डॉक्यूमेंट करके अगर आप दूसरे सेंटर को भेजते हो तो दैट इज वेरी इंपॉर्टेंट. While sending as well, you should have a good communication with the center where you're referring this particular case, because otherwise these women, if they are illiterate, they may get lost in the crowd and they will not reach to the facility because of fear of this getting lost in the crowd. And that's why one need to give them the good counseling on that part as well, how to make those arrangements to see that she reaches to a proper facility. Next, please. Yeah, next, yes. The classification of the this high risk pregnancy is depends on the obstetric complications, all the medical conditions, and the present pregnancy conditions. अब इसमें क्या क्या है कि which cases we say that those are high risk pregnancy cases. जिन औरतों को कुछ इन्फेक्शन हो, जैसे ट्यूबरकुलोसिस का इन्फेक्शन हो, उनको डायबिटीज डिटेक्ट किया हो, उनका ब्लड प्रेशर ज्यादा हो, अदर टाइप ऑफ कन्वर्जेंस लाइक एपिलेप्सी हो, उनके हृदय में कोई दोष हो, या उनको कुछ इन्फेक्शन जैसे HIV, सिफिलिस सिफिलिस और हेपेटाइटिस बी हुआ हो, उनको कुछ रेनल डिसीज है, थैलेसेमिया है, all those cases need to be addressed with a good multidisciplinary approach as well. Similarly, all those obstetric actually conditions where उनके लिए सिजेरियन सेक्शन करना जरूरी है या प्रीटर्म बर्थ है, उनके बच्चे की जो ग्रोथ है अच्छे से नहीं हो पाई है, उनके प्रीवियस हिस्ट्री में स्टिल बर्थ की, प्रेगनेंसी लॉस की हिस्ट्री है या ऑब्स्ट्रक्टिव लेबर की हिस्ट्री है, उस औरत को सीवियर एनीमिया है, जीडीएम है, प्रीएक्लाम्पशिया है, all that need to be tackled very very properly and we need to do the accordingly interventions which are required. हमको ये देखना है कि उनके लिए जो जो करना है वो सारी चीजें हमें करना बहुत इंपॉर्टेंट है. स्पेशली हमने कई बार देखा है कि ट्रीटमेंट ऑफ एनीमिया इज अ वेरी simple intervention but also a lot of complexity. कई बार आपने भी देखा होगा कि कई बार हम लिख के देते तो जरूर है, या इवन समटाइम्स वी डिस्पेंस द मेडिसिन, हम लोग हमारी तरफ से भी मेडिसिन देते हैं, लेकिन कई औरतें वो मेडिसिन लेती नहीं है. तो ये जरूरी है कि वो लेती है क्या नहीं, इसकी भी उसका भी कंफर्मेशन अपने पास होना जरूरी है. और सम सिंपल इंटरवेंशन, छोटी छोटी चीजें भी उसके लिए बहुत मायने रखती है. जैसे अगर हमने पूछा पेशेंट को कि आपके स्टूल का कलर क्या है, and if she says it is a black, that means she is compliant in taking those iron supplementations which we are dispensing or prescribing. जो हमने बताया है उसको ऑब्जर्व कर रही है. और ये छोटे छोटे इंटरवेंशंस अगेन इंपॉर्टेंट इसलिए है कि हमें मालूम नहीं होता, एंड आखिर में जब वो सीवियर एनीमिया के तौर पे अपने सामने आता है तो उस समय इट बिकम्स अ लिटिल डिफिकल्ट सिचुएशन एज फार एज द बेबी इज कंसर्न और द मदर इज कंसर्न. नेक्स्ट प्लीज. Yeah. The screening actually is the process of taking history, assessing and investigating the pregnant women to identify the possible presence of undiagnosed diseases. Regular and routine ANC is very important for identifying this high risk pregnancy by doing all those intervention, and early detection and timely management of this high risk pregnancy cases can prevent adverse pregnancy outcome. Next, please. Yeah, quite often there is a thin line between the physiological signs and symptoms which we see in pregnancy and the danger signs. For example, मैं आपको एक एग्जांपल देता हूँ, जैसे breathlessness. कई बार they say we have a shortness of breath, हमें सांस लेने में थोड़ी तकलीफ होती है. तो ये तकलीफ कई बार बिकॉज ऑफ हर ओवर डिसेंडेड यूटरस की वजह से भी हो सकती है, क्योंकि उसकी बच्चेदानी अभी बड़ी हो गई, दैट मे हैव लिटिल कॉम्प्रेशन ऑन द डायफ्राम, बट इट कुड बी द साइन ऑफ सर्टन डेंजर एक्चुअली कॉम्प्लिकेशंस लाइक द पेरीपार्टम कार्डियोमायोपैथी, जिसमें हृदय का आकार बढ़ता है। तो इसलिए ये बहुत इंपॉर्टेंट है कि ये सिग्नल्स अपने को एज अ केयर प्रोवाइडर should be able to identify, and accordingly we need to do the investigations as well. Similar about the headache, this headache could be because of some simple reason as well, but could be the presentation of high blood pressure, and we need to definitely see for the good blood pressure recording. अभी ब्लड प्रेशर रिकॉर्डिंग में भी कई बार फैलेसिस होना बहुत संभव होता है, दैट्स व्हाई our standards which we have in Manyata, we always tell them how to take the blood pressure, where to keep the BP apparatus, where how it need to be taken, and how to document it properly is very, very important. Suppose she has the palpitation, leg cramps, low back pain, constipation. Simple, actually, the physiological signs or the symptoms need to be addressed so that she will get more comfort during this antenatal period. And whenever there are such danger signs like जोर से पेट में दर्द हो या बच्चे की हलचल ना होती हो, एबनॉर्मल वजाइनल डिस्चार्ज है, वजाइनल ब्लीडिंग है, तो ये सारे एक्चुअली सिम्टम्स में उसके पीछे कोई मेजर कॉम्प्लिकेशन तो छुपा नहीं है, इसको देखना बहुत इम्पोर्टेंट होता है। नेक्स्ट प्लीज। या the history taking starts with the last menstrual period identification, because that will tell us about the duration of the pregnancy. But quite often, you know that कई औरतें ये बता नहीं पाती, especially I have seen those who come from the periphery or the smaller places, वो हमेशा कुछ त्योहार का नाम बताएगी या फिर कुछ इंसिडेंट से, जैसे इसकी शादी हुई थी उस समय पीरियड आया था, दे स्टार्ट डिस्कसिंग विथ ईच अदर. It's very essential to keep the calendar in your consulting room to identify those particular things, and we need to then accordingly correlate with your clinical findings, because quite often that history may be having some fallacies in that. कई बार उनमें गलती हो सकती है, बट हमारा क्लिनिकल एग्जामिनेशन एंड इवेंचुअली अगर हमने अल्ट्रासाउंड किया फर्स्ट ट्राइमेस्टर में, तो ये अल्ट्रासाउंड अपने को ये ईडीडी कैलकुलेट करने में मदद करता है. Otherwise, if she's very sure about this first day of last menstrual period, we should tell that it is 9 months plus 7 days will be our extended date of delivery, and that will tell us about the gestational age as well. Quite often the irregular menses में कई दिक्कतें हो सकती हैं, but उस समय मैंने जैसे आपको बताया कि आपके clinical findings by which you can identify the उसका जो abdominal height है uterus की, उसके हिसाब से या सोनोग्राफी के हिसाब से we can definitely tell them what will be her gestational age or what will be her expected date of delivery. It's very essential to understand about this GFLA status, where we need to identify each and every more careful to identify those complications in the antenatal period as well. Let us give you one
I think Dr. Milind's network
yeah.
has some issue. Sir, are you
Yeah,
back?
but actually, it was running smoothly and suddenly it stopped. So probably it was only for me happen or happen with everyone.
So we couldn't hear you for the past, I think, 45 seconds to 1 minute. So if you don't mind
Okay,
repeating
okay.
it from this slide.
Yeah, yeah. Yeah, I will do that. But please tell me that it got disrupted only for my computer or it happened with the entire group?
No, sir, it was fine for us.
ओके ओके डज गुड विथ यू ओके गुड गुड या हाँ तो अभी हिस्ट्री टेकिंग की हम बात कर रहे थे लास्ट मेंस्ट्रुअल पीरियड की हमने बात की उसमें हम पेशेंट्स को पूछते हैं कि उसको आखिरी महीना कब आया था एंड अकॉर्डिंगली वी कैलकुलेट द ड्यू डेट बाय एडिशन ऑफ द 9 मंथ्स एंड 7 डेज उसमें 9 महीने और 7 दिन की गिनती करके उसका expected date of delivery. We have to tell them that this is the expected date, not the confirmative date of delivery, and that she should understand. Now, कई बार वो बता नहीं पाती कि वो last menstrual period कब है, and then she correlated with some or other actually problem or the some of other occasion, the festival, and all those things. And accordingly, we'll have to calculate or we'll have to take the help of the sonography, especially in the first trimester when we do the sonography that will the actually the best parameter to identify the expected date of delivery or the gestational age. The GFLA status is very very important because that suppose हर एक इवेंट को हमने अच्छी तरह से उसको आइडेंटिफाई किया उसको हमने अच्छी तरह से नोट किया तो वो एक्चुअली सारी चीजें अपने लिए इम्पोर्टेंट होती है कि उसके क्या कॉम्प्लिकेशंस हो सकते हैं मैंने एक एग्जांपल अभी बताया था शायद आप लोगों को सुना ही ना दिया तो मैं वापस बताता हूँ कि अगर पेशेंट ने बताया कि मुझे पहली बार एबॉर्शन हुआ था और मेरा चेक क्यूरेटाज हुआ था एंड सपोज शी सेज दैट इट वाज नॉट कंप्लीटेड एंड नीडेड टू अंडरगो मुझे दूसरी बार क्यूरेटाज करना पड़ा या एमबीए करना पड़ा एंड देन आई गॉट माय एबॉर्शन कंप्लीटेड नाउ दीज आर द सब्जेक्ट्स यहाँ पे उनके बच्चेदानी के अंदर कुछ बदलाव होने का एडिजेंस होने का काफी चांस रहता है you have to be very careful while reading her sonography report or doing her sonography if you are doing on your own. The previous history of the placenta previa, adrenal placenta, and all those things need to be identified, need to be understood properly, and then uske hisab se we'll have to work on that. Next, please. Next. ग्रेविडा एंड द डेफिनेशन ग्रेविडा पैरिटी आप सब लोगों को आपके स्टैंडर्ड्स का जब ट्रेनिंग हुआ उस समय बताया गया हो बट बेसिकली द मोड ऑफ डिलीवरी और प्लेस ऑफ डिलीवरी इज वेरी वेरी इंपॉर्टेंट we'll have to ask about the any adverse perinatal outcome especially कई बार का यहाँ होता है the patients they tell us that everything was good and the baby got convulsion on the second day or third day and then we'll have to definitely think about some problem in the baby we call it the metabolic problems and if that has to be screened discussed with the your neonatologist friend or the pediatrician friend and accordingly we'll have to tell them about the further management about the operative process already I told you especially पहले सिजेरियन का उनके पास अगर कुछ नोट्स नहीं है तो आप वर्बली उनसे पता कर सकते हो कि पहले सिजरेन के समय कुछ दिक्कतें आई थी क्या कुछ कॉम्प्लिकेशंस हुए थे क्या कई बार पेशेंट्स इसके बारे में अपने को बताती हैं वो आपको बताएगी कि पहली बार ये गेप हुआ था या कुछ प्रॉब्लम्स हुए थे हेवी ब्लीडिंग हुआ था ये सारी हिस्ट्री वेरी मेटिकुलसली अपने को नोट डाउन करना बहुत इंपॉर्टेंट है and best ways to keep that continuity we'll have to give that to the patient writing as well just give me a 1 second to put this on the uh, yeah well next slide please in the current obstetric history especially you know that in our country quite often the patients they stay for first 7 months first 7 months they stay at one place and after 7 months they go to their mother's place and that's vice versa for the delivery so to see the previous record is very very important quite often they gave history of the pv bleeding in the first trimester and we'll have to begin very careful why that bleeding was in the first trimester and उसके बारे में इंफॉर्मेशन लेना वो सारे इन्वेस्टिगेशन देखना बहुत इंपॉर्टेंट है जो इन्वेस्टिगेशंस पहले हो चुके हो वो सारे इन्वेस्टिगेशंस का ब्यौरा अच्छे से लिखना बहुत इंपॉर्टेंट है एंड अकॉर्डिंगली व्हाट एवर हैज बीन मिसिंग विल हैव टू कंप्लीट दैट similar the story with immunization we'll have to see that which immunization she has not received and that immunization need to be completed when she comes to you and that's why this current obstetric history is again very important next please next medical history, family history, personal history, and the history of drug allergy is very important. Now, especially the women who got sensitive to certain drugs need to be written in a proper fashion with a red color ink because it is very, very important. And especially the women who are having the habits like smoking or the alcohol is very essential. Quite often we feel that if she's not smoking and then there's nothing is going to happen, but the passive smoking is again very important. Suppose the family member like husband is having a chain smoker, we'll have to identify that because we conducted one study in city of Sholapur under aegis of the Foxy again, and Dr. Sardesai identified that all those BD workers जो बीडीओ का काम करती है वो वर्कर्स में आईयूजीआर पाया गया, कुछ उसके ill effects because of fumes पाए गए, and that's why we need to ask all that history very carefully. Next please. Next, yeah. द मॉनिटरिंग ऑफ वाइटल्स इज वेरी वेरी इंपॉर्टेंट. अभी कई बार हमने ये देखा है कि ये नोट डाउन करते समय कुछ प्रॉब्लम्स होने की संभावना होती है, तो we'll have to properly mention about this pulse, respiratory rate, blood pressure, and the temperature. Your blood pressure, as I told you in the earlier slide, recording properly is very, very important. And if the BP goes beyond 140 by 90, we call it as a case of HDP or hypertension disorder. And accordingly, we'll have to manage that particular case. इट्स वेरी इंपॉर्टेंट टू अंडरस्टैंड कि सेकंड ट्राइमेस्टर में थोड़ा सा बीपी ड्रॉप होना संभव होता है, but that is not below 90. We'll have to be very careful about that as well. If it is less than 90, whether she's having any associated problem like loose motions or persistent vomiting. Next please. Next, yeah. We can look for the signs by examining her hands, conjunctiva, mouth, breast, especially for the inverted or flat nipples as I told you. कई बार उसके हैंड देख के उसको प्लेटी ने किया है, कोयलों ने किया है, तो उससे भी पता चलता है कि वेदर शी इज हैविंग द क्रॉनिक एनीमिया, वेदर हर आयरन स्टोर्स जो बॉडी में वो एडिक्वेट है या नहीं. एंड सिमिलर इज द एग्जामिनेशन ऑफ द माउथ आल्सो. The edema is again very very important, which could be because of preeclampsia, but there's only one thing: it could be because of the anemia and hypoproteinemia as well, and that need to be properly elicited by pressing the examining finger on the skin over the tibia for 10 seconds. The face, hands, and abdomen vulva need to be properly seen for preeclampsia, and we'll have to measure the height and weight of the patient for the obvious reason that suppose it is a short stretcher, which actually interventions may be required in those particular cases because of the contracted pelvis. Similarly, about edema, one need to also definitely see that whether it is because of the hypothyroidism. Quite often that is missed. We think about the preeclampsia, we think about the anemia, but it could be the unnoticed hypothyroidism where the patient come with the moon face or the puppy face, and we'll have to identify accordingly and do the needful if we identify she also has the hypothyroidism या उसकी thyroid level में TSH level में बढ़ोतरी है. Next please. Next. Yeah, the general examination, as you can see here, need to be done properly. We'll have to give some time to identify actually all those things. Even seeing for the icterus is very important because quite often we find some complications related to the liver could have a detrimental outcome, and we'll have to catch them in time and accordingly treat it. Next. When it comes to the abdominal examination and the identifying fetal heart rate is again a very important issue. Quite often it happens not only at the grassroots level but also in some of the multi-speciality hospitals. Especially, I have evidence that once actually one patient was admitted in one of the multi-speciality hospital in one of the very famous center, and when the FHR recording was given to me in the form of NST, it was recorded not by identifying the fetal heart but by identifying the maternal pulse. And that's why one need to tell them about how to auscultate for the fetal heart rate. We'll have to take the steps for examination and the inspection like size, shape, scar, and then the palpation with the help of with the R4 grips which have been taught to you. आपका जब ट्रेनिंग हुआ होगा उस समय आपको ये 4 ग्रीव्स फंडल हेड के बारे में बताया गया, उसको अच्छे से देखना बहुत इम्पोर्टेंट है। कई बार हमने ये देखा है कि कुछ फैसिलिटीज में patients they come continuously for the 9 months, and when they come to us at the end of the 9 month telling us that she's not delivering, and then we face that a situation, very embarrassing situation, she was not pregnant at all. So that's why, to avoid all those actually problems, we need to see that whatever has been taught in our actually the Manyata standards, we'll have to observe those standards very carefully. Next please. These are the pictures about the various grips, how we do the abdominal palpation of the pregnant uterus. Next, next. Yeah, about the investigations, again, it's very important. As I told you, this routine investigation just now we saw need to be identified, and accordingly we'll have to take the steps. कई बार हम लोग nowadays we screen for the aneuploidies also, जैसे कुछ बच्चों में उनके गुणसूत्र में कुछ दोष होने की संभावना है, उसकी भी सारे टेस्ट अवेलेबल है, according to the situation we'll have to tell them. Quite often during ultrasound examination itself we can identify certain markers, कुछ चीजें हमें बता सकती कि उस बच्चे में कुछ डिफेक्ट होने की संभावना है, and then we'll have to accordingly see that, we'll have to investigate further as well. Next please. Next, yeah. Screening for the key clinical condition is very very important, especially hemoglobin, urine albumin and sugar, blood group, HIV in hepatitis B and hepatitis C. And accordingly, we'll have to do that. Normally, we advise actually these investigations are the first NC contact when they come to us, and the hemoglobin estimation need to be done at the every visit if we are giving the plan of 4 visits. Similar story with the urine albumin, वो देखना बहुत important है, because by doing those actually investigations, we can identify the anemia, we can identify the blood hypertensive disorder of pregnancy, or the gestational diabetes, or the infections in the urine. कई बार पेशेंट्स को असिम्टोमेटिक बैक्टीरिया होने का चांस होता है, उस हिसाब से she may get anemia also because of losing the blood from the urinary tract, and we'll have to treat it accordingly. So we'll have to do the urine examination very carefully, which gives us idea about many conditions. Next please. Next. Yeah, you can enter. Yes, the VDRL, the OGTT, that 2 hours glucose challenge test is very important. Sonography and thyroid function test. Uh, Quite often we've identified that the patients को हमने बताया कि उन्होंने OGTT के लिए ग्लूकोज तो पिया है 75 ग्राम ग्लूकोज, लेकिन उसके बाद उसको तुरंत वॉमिटिंग हो गया. So keep watch on that is again very important. We'll have to ask the leading questions as well. कई बार पेशेंट्स के बारे में बताएगी नहीं, and then we'll get the false result of that GCT or GCT is negative. So we'll have to definitely see that it is properly observed. She is not allowed to eat once she consumes. एक बार उसने ग्लूकोज ले लिया तो उसके बाद उसको कुछ लेना नहीं, मुंह से वो बताना important है, and this need to be repeated at the 24 to 28 weeks, because that is very very important, which tells us about the gestational diabetes. Next please. Yeah. So this triage is very very important. History taking, proper investigation, and the good examination, which can identify us to tell about which are the low risk and which are the high risk cases. But we also emphasize that we'll have to adopt all those actually the precautions need to be taken in all cases, because कई बार low risk cases में भी कुछ complications होने की संभावना जरूर होती है. Next please. Yes. About the prophylaxis, nowadays you all know that we not only give the protection for the tetanus, we also give the protection against the pertussis and diphtheria also. And that's why the TDAP is very, very important. We'll have to tell them about taking those vaccinations. It gives protection not only against those diseases to the mother, but also to the baby up to 1 and 1.5 months by the time baby gets its own actually the next vaccination. The calcium and the iron supplementation are very, very important. That need to be emphasized. She should take it carefully, and she should take in adequate quantity as well. And कई बार worm infestation की संभावना हो तो उस समय अपने we'll have to give the tablet albendazole as a one tablet. Next, please. Next. About the counseling, what is important is tell her about the what care she need to take. She should make the arrangements of the adequate rest during as well as the after delivery, during pregnancy as well as after delivery, addressing a proper diet, physical activity and rest, breastfeeding, sexual activity, healthy timing and spacing of the pregnancy, and the contraceptive choices. Now this is again very important that when we advise that we'll have to be very, very careful also. क्वाइट ओपन मैंने देखा है कि जब उनको डाइट के बारे में बताते हैं उस समय you have to look at her socio-economic status as well. What actually she is going to afford. According to that, we can make smaller changes in our counseling also. For example, you feel that there are actually the monetary problems in the family. Simple actually interventions like giving the jaggery and the groundnuts also is very important, or giving the dates, the khajur, that also gives a good rich source of iron, and she's able to afford those actually the foodstuffs. And accordingly tell them, suppose we tell them to take something very expensive, she may not adhere and get maybe some other problems as well. Yeah, next please. Yes. ये चार कंडीशंस बहुत इंपॉर्टेंट है. ऑलरेडी वी हैव डिस्कस अबाउट दिस एनीमिया, हाइपरटेंसिव डिसऑर्डर्स, डायबिटीज एंड द असिम्प्टोमेटिक बैक्टीरिया. नेक्स्ट. यस. एनीमिया उसके अलग अलग ग्रेड होते हैं, जिसमें हम बोलते हैं कि माइल्ड है, मॉडरेट है या सीवियर है. एंड अकॉर्डिंगली वी हैव टू ट्रीट दैट एक्चुअली एनीमिया either by giving the oral tablets or by giving the injectable preparation, because there may be certain issues. इसके absorption में भी issues हो सकते हैं. We have to calculate it with the identifying a proper dosage of giving that injectable preparation. And also we'll have to look at the date of delivery. If it is very close, sometimes we have to also think about severe anemia, the blood transfusion as well. But again, that decision need to be taken very calculatively, and we cannot actually suddenly go with the very tertiary level management in cases of this anemia. Next please. Next. Yeah. Yes. Next please. This tells about the how we need to give the various supplementation. Next. Yeah. Yes, nutritional counseling, already I told you what is important and what need to be avoided as well. That is again very important. Taking excessive tea or excessive coffee could actually come in between the absorption of those foodstuffs which she's taking. And then accordingly we'll tell them while taking the tablets also how to they keep distance between the iron tablet and the calcium tablet. Suppose they take it together, the absorption issue may come in, and we'll have to tell them to space it. एक सुबह एक शाम जैसे बताना बहुत important है. Next please. Yeah, next. Yeah, about the hypertensive disorders, basically we have discussed a lot about it, but what is important is two things. One is about the proper BP recording. That is again very important. We'll have to see that it is properly recorded. We'll have to take the two readings as well whenever you feel there is some confusion. And similar story about the identifying the urine albumin, that need to be properly done with your dipstick method, or sometimes we do with the boiling of the urine as well, and we will not miss actually our visual impression. The danger signs are very important. Whenever we take the round, we need to identify that we have admitted a case of severe preeclampsia or the moderate preeclampsia, whether she's having headache, blurring vision, swelling on the face or the hands, whether she's having difficulty in the breathing, whether she gets the pain in the epigastrium, that is पेट में ऊपर, and if the urine output has reduced, इसका urine कम हो गया है, तो उस समय it's important to immediately take the next step to manage that particular condition. Next please. Yeah. If this blood pressure actually is there even before 20 weeks of pregnancy, those are we call the chronic hypertension, means ये उसको बीपी पहले से है और उस पे उसको pregnancy रह गई है. So we'll have to identify this between these, and also the differentiation during pregnancy about the gestational hypertension, preeclampsia, and if she sets in convulsion, we call it as eclampsia. Next. या gestational diabetes के बारे में हमने काफी चर्चा की, how to do it properly. And if it's positive, then we'll have to definitely take the further actual management, which could be multidisciplinary approach as well, where we need to tell them the dietary counseling, and also sometimes the medications are required that you can do by taking into consideration of your diabetologist or the physician friend, and you'll have to see that her blood sugar is properly maintained. Nowadays, we have realized all those cases of GDM, suppose we keep her euglycemic, means उसका ब्लड शुगर लेवल अगर मेंटेन हो गया है, तो कई बार कुछ प्रॉब्लम्स जो हम एक्सपेक्ट करते हैं गेस्टेशन डायबिटिक की वजह से वो नहीं आते. नेक्स्ट प्लीज. नेक्स्ट. यस, नेक्स्ट प्लीज. या नेक्स्ट. या द इन्फेक्शंस, जब भी इन्फेक्शंस हो तो उसको ट्रीट करना बहुत इंपॉर्टेंट है. एंड अगेन we'll have to see that we'll have to ensure that she's taking those medication adequately, especially for the sexually transmitted infections. We always tell about syndromic management, where we want to cover everything with one set of go, and we'll have to treat that infection accordingly. Next please. The last thing is again the respective maternity care during antenatal care is very important, where we need to tell them everything actually in very crystal clear way about telling about yourself, who you are, who is going to examine her. She may ask a lot of questions during this antenatal visits or during the registration for the delivery. It's our duty to tell her very sympathetically about all her questions, because that pregnancy is first time for her, and for the care providers they conduct daily 4 5 or 6 deliveries and they feel it's just a routine, but for patient it's first time. So we'll have to definitely tell the all those queries which we may find as a silly questions, may not be silly. Those are the real queries the pregnant woman faces during her antenatal care, and we'll have to accordingly tell her. We should not get the judgmental, that is very important. Quite often we have noticed that we ourselves decide that she's doing all those, but there may be certain issues which we are unable to identify. उसके घर में उसके आजू बाजू की विषय में जो प्रॉब्लम्स है उसके बारे में हम पता नहीं कर पाते. उस समय we have to little more actually the careful to give the proper care so that we can avoid further complications. We'll have to tell about the all battery of investigation which we do normally, and we'll have to also tell about the what things we need to do when we identify any particular factor which is called as a high risk pregnancy factor. कई बार क्या होता है कि ये बताने में हम कुछ गलतियां कर बैठते हैं या कुछ inadequacy हम प्रेजेंट करते हैं और पेशेंट देन टेक द that complication lightly. So we'll have to be very careful to sit comfortably with her by the so that she will identify all those complications in her own language, in her own actually the understanding. कई बार इसमें लैंग्वेज बैरियर का बहुत इश्यू हो सकता है, जैसे in our belt there are many patients who speak Kannada, who speak Telugu. So we'll have to be very careful in what they are saying to understand that. We can take the help of interpreter and we can identify many conditions. Next, please. So the key messages are the quality antenatal care is life-saving, prevents maternal and neonatal complications. What is important is early registration and regular visits, the proper timely care and the follow-up. History taking matters, which identifies risk factors early. Clinical examination is essential, which tracks maternal and fetal well-being. Basic investigation saves life, for example, anemia, infections, and more. Ultrasound guides care, dating and anomaly scan are very important. And we can flag the high-risk pregnancies for close monitoring and the referral effective counseling is again very important, because many times these danger signs, the nutritional issues and the birth planning can be very well managed with good counseling, and then comes our treatment. Next, please. So thank you very much, and I think I must say big thanks to the Manyata team as well for this wonderful opportunity to interact with you all.